wide-area transepithelial sampling with computer-assisted analysis to detect high-grade dysplasia and cancer in Barrett's esophagus, a multicenter randomized study. Introduction. Patients with Barrett's esophagus undergo regular endoscopic surveillance to detect dysplasia in the early stages when it is amenable to endoscopic treatment to prevent progression to invasive esophageal adenocarcinoma. Because dysplasia is often not visible during endoscopy, there is general agreement that forceps biopsy sampling according to the Seattle protocol is currently the best method for detection of dysplasia in the absence of visible lesions. This involves random forceps biopsies, FBs, obtained from 4 quadrants at 2 centimeter intervals along the BE segment using large-capacity forceps. However, dysplasia and early cancer may be patchy or focal, and as a result can be missed by FBs. FBs are therefore associated with sampling error and missed dysplasia. Furthermore, the Seattle protocol is time-consuming, especially in longer BE segments. Studies have shown that approximately half of gastroenterologists do not adhere to the Seattle protocol. Wide-area transepithelial sampling, WATS, with computer-assisted 3D analysis is a novel brush biopsy technique used to broaden the area of sampled BE. The WATS brush has long, hard bristles and is abrasive, so it enables deep transepithelial specimens to be obtained. Use of the brush is relatively easy and not time-consuming. Tissue obtained by WATS undergoes computerized neural network analysis that helps identify the areas on the slide that are most likely to represent neoplastic change. These areas are then presented to a pathologist for evaluation and diagnosis. Previous studies have shown a 2% to 42% absolute increase, or 42% to 329% relative increase in the detection of high-grade dysplasia, HGD, or esophageal adenocarcinoma when WATS is used as an adjunct to FB. However, these studies had some methodological limitations. For example, patients with visible lesions were included. WATS was primarily assessed as an adjunct to FB instead of as a replacement procedure, and/or studies had a primary focus on the detection of intestinal metaplasia and not dysplasia. Therefore, the purpose of this study was to assess the value of WATS as a replacement for FBs for the detection of high-grade dysplasia and esophageal adenocarcinoma in Barrett's esophagus patients without visible lesions. This was the first prospective randomized study of this nature in a referral population of Barrett's esophagus patients with a history of dysplasia. Methods. Patients with known Barrett's esophagus and a recent history of dysplasia without visible lesions at 17 hospitals were randomized to receive either wide-area transepithelial sampling followed by forceps biopsies or vice versa. All WATS samples were examined with computer assistance by at least 2 experienced pathologists at the CDX Diagnostics Laboratory. Similarly, all forceps biopsies were examined by 2 expert pathologists. The primary endpoint was concordance or discordance for detection of high-grade dysplasia and esophageal adenocarcinoma between the 2 techniques. Results. 172 patients were included, of whom 21 had high-grade dysplasia or esophageal adenocarcinoma detected by both modalities, 18 had high-grade dysplasia or esophageal adenocarcinoma detected by WATS but missed by FB, and 12 were detected by FB but missed by WATS. The detection rate did not differ between WATS and FB. Using WATS as an adjunct to FB significantly increased the detection of high-grade dysplasia or esophageal adenocarcinoma versus FB alone. Absolute increase 10%. Mean procedure time in minutes for FB alone was 6.6 minutes, WATS alone was 4.9 minutes, and the combination was 11.2. Conclusions. Although the combination of wide-area transepithelial sampling and forceps biopsies increases dysplasia detection in a population of Barrett's esophagus patients enriched for dysplasia, we did not find a statistically significant difference between WATS and FB for the detection of high-grade dysplasia or esophageal adenocarcinoma as a single modality.